Thanks very much. Hi, everyone. Really nice to be with you today. So I'm the course director of the Bachelor of Physiotherapy program, and I'd just like to start with an acknowledgement of country. So we pay our respects to all First Nation elders, past and present, from the lands where Charles Sturt University students reside, but also the lands that people are on today. And in particular, we acknowledge the First Nations Australians and the people of the Wiradjuri, Ngunnawal, Gundungurra and Biripi people, who are the traditional custodians of the lands in which our Charles Sturt University campuses are located. So there's currently about 45,000 registered physiotherapists working across Australia, and our job is really to improve the quality of life of people in the community, and that can be all people of the community from all ages and all walks of life and interests. We help to maintain and restore movement and function in people who might be affected by a disability. They might have had an injury, they might be recovering from an illness. And so our work is really important in helping people get back to their usual selves and to participate in the communities that they want to participate in. As physiotherapists, we're experts in movement, and we really promote health and independence and quality of life for people across the lifespan. So that's really little babies all the way up to older adults as well. So whereabouts do we work? So we work in lots of different settings throughout Australia. We work in hospital settings, and we can work in lots of different areas of the hospital. So sometimes we might work in intensive care units. We can also work in orthopaedic units where people are recovering from surgery. We can also work in neonatal intensive care units where we're working with little babies. We can work in paediatric wards. We can work in general medical wards as well. So there's lots and lots of different avenues, I think, and lots of different areas of practice that we work in. We work in private practice settings. So there's lots of private practices in Australia where physiotherapists work privately. They have patients or clients who come to see them. We also work in sporting clubs and have a lot of physiotherapists who work specifically with sporting teams and travel with sporting teams and help work with those teams to rehab sports people who have injuries, but also help in injury prevention as well to make sure that we're limiting the amounts of injuries that sports people are having. We work in rehabilitation settings. So that might be working with patients who are recovering from a stroke or other brain injury or other orthopedic injury where they need a bit of extra intensive rehabilitation. It could also be people who have complex disabilities who need a lot of intensive physiotherapy work, and so they'll work in they'll go to a rehabilitation setting, and we have physios who specialise in those areas. We also work in non-government agencies and not-for-profit organisations, so there's a number of those across Australia as well as community healthcare settings, aged care settings. We have physiotherapists in schools in some of the states in Australia as well. We have physios who work in health promotion, occupational rehabilitation, so getting people back to work and back into their work environment, and also in the mental health setting. And then we also have many physios working in research as well. So these are the kind of key areas of physiotherapy practice that we work in. Some people may work or find themselves in more of a rural area where they cover quite a number of these different areas of practice, and others might work in a more metropolitan or city centre where they'll start to specialise in particular areas of practice. So you can see there's a big long list there. In the Bachelor of Physiotherapy program, we train our physiotherapy students to be what we call an entry-level graduate. So they have a broad range of skills in a lot of different areas of practice. They are competent to practice as new graduate physiotherapists. And then once you graduate, you might decide to specialise in a particular area. So after a few years of working as a general physiotherapist, you might then decide that there's an area of practice you're really interested in, and it's maybe one of these areas that's listed on the slide. And then you can do additional training to become a specialist in that area. So our Bachelor of Physiotherapy program is fully accredited with the Australian Physiotherapy Council. So that's the accrediting body that says, yes, you can teach physiotherapy, and when your students graduate, they'll be eligible for registration with APRA, which is our registration body. That means that you can practice as a physiotherapist in Australia. We have a very proud history in our physiotherapy program, spending over 2 decades, and we're well regarded for producing highly sought after graduates who have launched very successful careers in Australia. And then some of our physiotherapists have ended up overseas and working overseas as well. Throughout the program, students go out on what we call clinical placements, where they go into hospitals or into private practices and do clinical placements. And for those who do the Bachelor of Physiotherapy, you will do more than 1,000 hours worth of supervised clinical practice, and it will be in a variety of areas. So it might be rural or metropolitan settings, but also across those different areas of practice that we had up listed as well. The great thing about physio, it's a very hands-on profession, and so you get practice from day one, and you do a physiotherapy subject in your very first semester of university. We work in our on-campus facilities, so our classes are face-to-face, and we do lots of activities in teaching students how to become good physiotherapists. So we have simulated environments, so simulated hospitals, where physio students get to go and work in a simulated hospital. So it's a little bit less daunting the first time you kind of go into that environment, and you learn lots of skills before then you move out into your clinical placement and go into the real world and practice those things. So, so all of our staff are experienced physiotherapists. Many of our staff have worked clinically, and a lot of our staff are also research active as well. So we do lots of work in physiotherapy, but also in research to ensure that the evidence that we're using is really strong, and we're contributing to that evidence base. We're highly involved with the professional community throughout Australia, and we help to contribute to the national professional standard panels as well. So we're really active within that space, and make sure that our curriculum's up to date and good to go with all the current practices and standards. The other really great thing about being at Charles Sturt is we get to know you. So our classes aren't super large, that we don't know all the students, and you get to work with us really closely in helping to develop your skills, which is a really great thing. When you graduate from our Bachelor of Physio, you're really well prepared for a wide range of careers. And as I said before, physios work in such a varied areas and settings. And so there is a potential for our graduates to work in those different areas and settings as well, and to move around. In physiotherapy, there's lots of different options. You might start working in neurological physiotherapy, but then decide you would like to move into pediatrics. And so there's lots of avenues to allow you to do that, which is really great. For those students who are high achieving students, we do have an integrated honours program. So at the end of second year, students will be able to submit an application to apply for the honours program. There is a criteria that you have to meet in order to move into the honours program, but the honours program allows you to do some research and advanced research alongside your physiotherapy degree. Okay, so this is just a little bit of an overview of what the Bachelor of Physiotherapy aims to do. So it aims to prepare graduates for practice as physiotherapists in a diverse range of contemporary healthcare settings, developing the distinctive capabilities required for practice in rural and remote, Indigenous and culturally diverse settings. And our educational approach values diversity of students' backgrounds and learning preferences and partnerships between students and staff to optimise learning outcomes. So just a few details on our program. So our program is 4 years. It's 4 years full-time, and it's on campus. And we have 3 campuses that offer the Bachelor of Physiotherapy. The clinical placements that I was talking about, we call them work integrated learning placements, and they happen in the second year of the physiotherapy program. So there's a 2-week clinical placement in the second year. And then in the 4th year, is when the majority of the clinical placements happen. And for those who are doing the standard program, it will be 5-week clinical placements in that final year of practice. The placements can happen anywhere in Australia, but mainly in New South Wales. We do have some interstate opportunities for placements as well. Okay, that's it really for a very quick introduction to the Bachelor of Physiotherapy program at CSU. I'll hand over to Swati now, and she can give you some more information, and maybe we'll leave the questions to the end.